Now, we haven't seen a lot of toxicities in combination. Certainly, I can say from Keynote 365, we now have data in combination with enzalutamide, with docetaxel, with PARP inhibitors. With the PARP inhibitors, we didn't see that much. The toxicity profile looked very similar to what the individual agents would look like alone. If you look at it with enzalutamide, it was pretty good too. There might have been a little bit more rash. And if you look at the combination of, let's say, pembrolizumab with docetaxel, perhaps the colitis rates were reported a little bit higher at 10%, but we have to recognize that there's a lot of sensitivity to those calls. If you have overlapping toxicities like diarrhea, let's say, it's very easy for somebody to call colitis. It's not necessarily immune-mediated colitis that requires high doses of steroids. There were a couple of pneumonitis cases as well. So I would say this, we have to keep a close watch on the potential toxicities in combination of things, but I don't think there's that big of a signal. Now, when you're talking about the PARP inhibitors, I was talking about the IO agents. When you're talking about PARP inhibitors, I think the one thing to keep in mind is when you have an agent that's leading to potentially to myelosuppression, we can see myelosuppression with PARP inhibitors as well. And so those would be the overlapping toxicities that I would pay close attention to. But so far, not major concerns.